Hello everyone, welcome to our first day of class. This is Sowkya. Today I am going to teach you anatomy. We are going to start the new series of upper limb. In this class, we will cover the basics of upper limb. By the end of today's session, you will build foundation lay for our upcoming classes of upper limb. Now, here is the index which outlines the main topic of our discussion. First, we are going to discuss about the introduction of the upper limb. What are the functions of the upper limb? What are the main changes, evolutionary changes got into our upper limb? What are the bones involved in the upper limb? What is the comparison between upper limb and the lower limb? Next, we are going to discuss bones of upper limb. How many bones are there? What are bones involved in the different regions of upper limb? Then next, we are going to discuss pectoral region. The pectoral region, the main region in the chest. Then axilla. We are going to discuss complete boundaries, structures, components of the axilla. Then we will discuss back of body and the scapular region and scapular, subscapular spaces. And then we will discuss shoulder joint, the major joint of the upper limb. Yes. And then the arm region, the main region of the upper limb, and the bones in it, the muscles, nerves, arteries, and the fossa, the main fossa of upper limb, the cubital fossa. And then forearm. We will discuss the forearm, muscles, arteries, and back of forearm, front of forearm. And then we will discuss the elbow joint, the major joint in the upper limb, elbow joint, its articulating surfaces, and mainly the carrying angle. What is carrying angle? And then hand. This part of upper limb is known as hand. We will discuss the hand, and at the last we will end with wrist joint. So today our discussion is about introduction to upper limb. Yes, today we are going to discuss about the introduction to upper limb. And now this is the upper limb, right? The part extending from the shoulder to the tip of the fingers is known as upper limb. Yes. In human, we have 4 limbs. 2 are upper limbs and 2 are lower limbs. The upper limb, the parts of upper limb are shoulder, arm, forearm, and the hand. See, the part including clavicle and the scapula and the upper end of the shoulder, the upper end of the humerus is included under shoulder. Yes, and the part extending from the shoulder to the elbow joint, the part extending from the shoulder to the elbow joint is known as what? Arm. And now the part extending from elbow to wrist joint is known as forearm, is also known as antebrachium. Now, and the part from forearm to the tip of hand is known as hand or manus. It is also known as manus. Yes. The shoulder region includes what? Clavicle, scapula, and head of the humerus. This is the humerus. The humerus is a bone of arm region extending from shoulder to elbow joint. This humerus is involved in the formation of 2 major joints of the upper limb. What are they? Shoulder joint and elbow joint. So the upper end of the humerus is involved in the formation of shoulder joint along with the glenoid cavity. This is the glenoid cavity, part of triangular flattened bone scapula. So, the upper end of the humerus is articulated with the glenoid cavity of the scapula in the formation of what? Shoulder joint. And the lower end of the humerus, this is the lower end of the humerus, it is articulated with the upper end of bones of forearm. Then what are the bones of forearm? Radius and ulna. See, this is the radius, which is presented laterally. Yes, and this is the ulna, which is presented medially. Yes, this bone, the radius bone is homologous to the bone of leg, that is tibia, which is medially presented in the leg. Yes, the bone of forearm that is presented laterally, radius is homologous to leg bone, that is tibia, that is presented medially. Now, so the lower end of the humerus is articulated with the upper end of radius and ulna forming elbow joint. And now, the lower end of the radius, mainly the radius, is articulated with the carpal bones. These are the carpal bones. There are 8 carpal bones which are arranged in 2 rows. Each row containing 4. Yes, each row containing 4 bones. And this lower end of the radius, this is a styloid process of the radius, the extended part laterally present. So the lower end of the radius is articulated with the, this is the proximal row and this is a distal row. So the lower end of the radius is articulated with the proximal row of the carpal bones forming radiocarpallar joint, that is wrist joint. Yes, this is the another major joint in the upper limb. First joint is the shoulder joint, next joint is the elbow joint, then next is the wrist joint. So radius and carpals forming wrist joint. Now this part extending from here to here is known as hand or manus, containing 3 major parts. What? The carpus part, the metacarpus part and the phalanges part. This is known as carpus, containing what? Carpal bones. Obviously, there are 8 carpal bones arranged in 2 rows. 1, 2, 3, 4, 5, 6, 7, 8. This is known as hook of Hammett. Yes, this is the bone. Now, this small bone is there. No? That is called piriform. Yes. Now, this is carpus, also known as wrist. Now, metacarpus, this region extending from carpus to proximal part of the phalanges is known as metacarpus, containing metacarpal bone, obviously. Containing what? Metacarpal bones. Now, how they are numbered? They are numbered from lateral to medial. So the thumb is numbered 1, 2, 3, 4 and 5. So there are 5 metacarpals in each palm. Yes. Now the phalanges, the distal part of the hand containing phalanges. Each finger, there are 4 finger and 1 thumb. So each finger containing 3 digits. Yes, 3 digits. Except thumb, which contains only 2 digits. Yes, these digitations are, these bones are short, miniatured long bones. Yes, miniatured long bones. These are also long bones, but miniatured, which are placed vertically. Yes, these are the miniature bone placed vertically. And thumb containing only 2 bones and other 4 fingers are containing 3 bones. Yes, this is a carpus, this is a metacarpus and these are the phalanges. Once again, the clavicle. Clavicle is the long bone presented horizontally. This is the only bone that presented horizontally. Yes, it contains medial end and the lateral end. And now it acts as what? Strut. It acts as a screw which connects 2 parts, which connects 2 parts and kept these 2 parts apart from each other. Yes, let's imagine this will be the screw. This white color is the screw and this is one part and this is one part. This screw keeps these 2 attached and kept them apart. So here the clavicle keeps the hand away from the body. Let's imagine this is my hand is the body, this is the body. So this clavicle always keeps the hand apart from the body. It is not always attached to the body, right? It is kept away from the body. So this function is done by clavicle. So the clavicle helps in the suspension of hand from the axial body. The body trunk, the chest trunk is known as axial body. So our upper limb is freely suspended from the axial body by a strut called clavicle. And this is the scapula. A flattened bone. Yes, this is a scapula, a flattened bone presented posterior aspect of thorax. That too laterally. This is not present centrally, but laterally it is presented. That too posterior in aspect of the thorax. It contains glenoid cavity which is articulated with the head of humerus, head of upper limb of humerus, forming what? Shoulder joint. And this is the long shaft of the humerus, lower end of the humerus and upper end of the radius and ulna forming elbow joint. Now, the lower end of the radius is articulated with the proximal row of carpal bones forming wrist. This is the carpus containing 8 carpal bones arranged in 2 rows, and these are articulated with the metacarpal forming carpo-metacarpal bones. Carpo-metacarpal joints. Now these carpals articulated with each other forming intercarpellar joint. Yes, and these are the metacarpus. These are the phalanges. Now let's see in the description. Yes, the upper limb is also known as upper extremity, which is freely movable, especially the part which is suspended. This is the hand, extending from wrist to tip of fingers is known as hand, which is easily movable, which is adapted for grasping, holding the picking the objects and manual movements, fine prehensile movements, but they are modified in such a way in order to move such precision works, prehensile works, fine movements which cannot be done by any other organism on the planet. And now, hand adapted for grasping and manipulating objects, obviously. Now what is the difference between upper limb and the lower limb? See, upper limb is mainly adapted for grasping the objects, holding the objects, picking the pencil, writing and arting, crafting, etc. Now lower limb is mainly adapted for what? Weight bearing, locomotion. See, let me explain you. In the animals, these are the forelimbs, front limbs which are present front. These are the hind limbs or hind limbs. This is the whole body. Let's imagine this is a tail having 2 ears and horns. Okay. Now the whole body weight, body mass is equally balanced on these 4 limbs. Yes, 4 limbs and the hind limbs. So in animals, rather like animals, our human body is adapted. See, this whole body is erected in humans. These are the hind limbs became lower limbs. These 4 limbs became upper limbs like this. And now these 2 limbs, that is lower limbs, are adapted for completely bearing the whole body weight with the help of what? Pelvic girdle. With the help of pelvic girdle. What is pelvic girdle? A girdle means what? Bridge. Like a bridge, a closed path, a cord which supporting. Yes, pelvic girdle is a closed girdle which helps in weight bearing of the axial body, complete upper body and the trunk on pelvic girdle and the limbs. And now these upper limbs, these 4 limbs are converted into upper limbs in human. These are modified for what? Prehensile movement, fine movement, arting, sieving, writing, drawing, fine movements. Yes. Now let's see what are the changes in the upper limb for prehensile movement. See, only human can do prehensile movement. Rather dogs, buffaloes, horse cannot do like us. Prehensile movements only can be done by humans, right? Now the clavicle acts as a strut, keeps upper limb away from the body. As we said, the clavicle acts as a strut which keeps the upper limb away from the body, rather keeping attached. It is kept apart, right? Now opposition of the thumb. See, this is very characteristic in the human. This is the opposition of the arm. The thumb is turned 90 degrees in order to touch these 4 fingers, which is absent in almost all animals. and adaptable changes for the free mobility of the fingers and hand. See, these are the creases. These are the creases. There are some elevations, there are depressions on the palm. In order to what? To grasp, to pick, to hold the things. Yes? And let's see pectoral girdle. We have discussed about pelvic girdle, which is present to support the lower limb. Here is a pectoral girdle as like pelvic girdle. Here, which connects upper limb to the trunk. Yes, pectoral girdle is formed by two bones, clavicle and the scapula. Here, opposite side, another side of clavicle and the scapula. These two medial sides of the clavicle are articulated by manubrium sterni. What is it? It is a bone presented anteriorly in the thorax region. Manubrium sterni is the first part of sternum. So these clavicles are anteriorly connected by manubrium sterni, but this girdle is kept opened, which is incomplete by what? Scapula. These two scapula are posteriorly not connected. They are kept apart. Yes. Why? As we know, pelvic girdle is a closed girdle. Pectoral girdle is an opened girdle, because pelvic girdle is able to weight bear. In order to bear weight, that should be closed. In order to move, in order first for the mobility, for movement, for doing actions, abduction, adduction, the girdle should be opened, right? Yes. Now, the two bones forming pectoral girdle is what? Clavicle and the scapula. Scapula connected with the clavicle. Here we have this is the clavicle lateral end. This is the acromion process of the scapula, connected and forming acromioclavicular joint. Yes, the scapula connected with clavicle forming acromioclavicular joint. Obviously, clavicle is articulated axial body. Here, as we said, medial part of the clavicle articulated with the manubrium sterni, part of sternum, to connect with axial body, forming sternoclavicular joint. Yes. Now, as we said, it is an incomplete girdle. It is an open girdle, rather like pelvic girdle. Why? Why it is open? For enhancing movements, for mobility, for abduction, high adduction, circumtension, freely mobile functioning. Now, it is conducted anteriorly by manubrium sterni, forming what? Sternoclavicular joint. Now, what is the difference between pelvic girdle and pectoral girdle? Pelvic girdle is weight bearing. Yes. And that too, it is a closed girdle. Here, pectoral girdle is adapted for mobility, which is an incomplete girdle. Yes, which is an incomplete girdle. And next, what are the major parts of the upper limb? Let's see what are the major parts of the upper limb. Have we seen that the main part, shoulder and arm, the main part, shoulder, arm and the forearm. Arm is known as brachium. So arm is known as brachium. Forearm is known as antebrachium, and the last part is known as hand or manus. Yes. Now let's see what comes under shoulder. As we discussed, clavicle, scapula and upper end of the humerus forms the shoulder. Now arm, it is known as brachium, which extends between shoulder and elbow. Yes, which contains the main long bone humerus. It contains three parts. Normally a long bone contains three parts: upper end, shaft and the lower end. Upper end involves in the formation of shoulder joint, lower end involves in the formation of elbow joint, right? And now forearm, it is also known as antebrachium, extends from elbow to wrist, as we said, containing two bones, radius and ulna. Radius is presented laterally, ulna is presented medially. This radius is homologous to tibia. Yes, this radius is homologous to tibia in the leg region. Now these two, ulna and radius, are articulated with each other, forming radio-ulnar joint, superior or inferior. And now let's see the part of hand. Hand containing three parts, as we said. carpus, metacarpus and phalanges. Carpus, 8 carpal bones arranged in 2 rows, 4 plus 4. These are proximal row of carpals are articulated with lower end of the radius forming radiocarpallar joint, and these carpals with each other forming intercarpallar joints, and the distal row of carpals forming articulation with the metacarpal forming carpometacarpal joint. So 3 joints are made by carpals. And now metacarpals. These metacarpals are articulated obviously with the carpals forming carpometacarpal joints, with each other forming intermetacarpal joints, and also articulated with, this is the proximal row of phalanges, yes, forming metacarpophalangeal joint, yes. And now let's see. Carpals, there are 8 carpal bones, 2 rows, articulated with each other forming intercarpallar joints, with metacarpal carpometacarpal joint, and with radius radiocarpallar joint, yes. And hand proper, this is the hand proper which involves the metacarpal bones, yes. See, this part is the main part, hand proper. 1 to 5 from lateral to medial. There are 5 metacarpals. Number 1 is indicated for thumb. Number 5 is indicated for little finger. Now they articulated with each other forming intermetacarpallar joint. Proximally articulated with first, they are proximally articulated with distal row of carpals forming carpometacarpal joints. Distally articulated with phalanges forming metacarpophalangeal joint. Yes, let's see the comparison between upper limb and the lower limb. Lower limb is containing pelvic girdle. What is difference between again pelvic girdle and the pectoral girdle? Pelvic girdle is for lower limbs, pectoral girdle is for the upper limb. Pelvic girdle is for weight bearing, pectoral girdle is for free mobility. Pelvic girdle is obviously a closed girdle. Pectoral girdle is open girdle which is kept apart, in which scapula are kept apart. The major joint, ball and socket joint in lower limb is hip joint. The ball and socket joint in the upper limb is shoulder joint. The arm, this is the arm, right? The arm is homologous to thigh region of the lower limb, yes. And the knee joint in the lower limb is homologous to elbow joint in the upper limb. The leg of lower limb is homologous to forearm. The bones containing in the leg are fibula and tibia, in this radius and ulna. The ankle joint is homologous to wrist joint, yes. The hand is homologous to foot in the lower limb. The carpus, metacarpus fingers are homologous to tarsus, metatarsus, toes of the foot. Yes, this is a complete brief discussion about the humerus. This is complete introduction to the upper limb. So let me know in the comment if you have any doubts and like the video. Thank you.